You're watching WMBC-TV, Newton, New Jersey.
Welcome back, and now let's go to the feature of this week's Hometown. A common disease that cuts off blood circulation can lead to serious problems like a stroke or heart attack. But that's being treated faster and more efficiently thanks to new technology. You may not know what peripheral artery disease is, but the chances are it will affect you or someone you love. Here's an inside look at how doctors are treating this growing disease. Fishing is one of Robert Garnett's favorite activities. At 67 years old, the Marine vet gave up basketball and jogging for a less strenuous pastime. But last fall, something more serious than age got in the way, something called peripheral artery disease.
It was hurting so bad that I wouldn't do no exercise or nothing like that. Going fishing, playing basketball, or even walking my dog, you know what I mean? Even walking my dog. He's getting lazy now because I'm not up out running around the streets with him.
He complained of pain in his feet and legs for years, but when his podiatrist couldn't feel his pulse during a routine exam in the fall, she suggested he see Dr. Ramzan Zakir, the director of the Peripheral Vascular Program at St. Peter's University Hospital in New Brunswick. He sees patients with peripheral artery disease, also known as PAD, all the time.
Every time they try to walk a certain distance, they get excruciating pain, they have to stop. In later manifestations, patients can develop wounds that don't heal, and these patients are at risk for amputations.
So what exactly is PAD, and why does it affect patients this way?
That's when you have a blockage in the arteries that supply the extremities. It's most commonly in the legs. So it's the same sort of pathophysiology as when you have a heart attack and you have blockages in the heart. It's plaque buildup that reduces the flow.
According to the CDC, 8 million people suffer from PAD in the U.S. In the past, patients would be treated with invasive surgery and even amputated. But a new technology known as the light box is changing that.
We have a great new technology called the light box, and the catheter is called the Ocelot. What this catheter does, it allows us to see inside the artery. It provides real-time intravascular imaging, and we're able to direct the catheter according to what we're seeing inside the artery. Before the traditional approach, we're kind of navigating in the dark. You know, we're hoping we're going in the right direction, but we really don't know. So this way, we're able to cross with minimal damage to the artery, or no damage to the artery, and we're able to stay inside the actual lumen of the artery. And this, once we're crossed, then we could deliver our treatment.
Dr. Zakir says with real-time vasculatory imaging, he's able to navigate the blockage safely without damaging the structure or integrity of the artery. The Ocelot system incorporates an imaging fiber that uses light waves to act like a camera at the catheter's tip.
We navigate our catheter away from the healthy tissue and towards the disease and towards the plaque. And just by rotating these markers, that's how we align the catheter in the right direction. You know, before the traditional approach, we're kind of navigating in the dark. You know, we're hoping we're going in the right direction, but we really don't know. So this way, we're able to cross with minimal damage to the artery, or no damage to the artery, and we're able to stay inside the actual lumen of the artery. And this, once we're crossed, then we could deliver our treatment.
Dr. Zakir, who's practiced for 13 years, says patients undergo conscious sedation. Within 2 hours of the surgery, he's seen most walking again and back to a normal routine.
Impact is essentially immediate. You know, once they recover, they start walking, and that pain that they had is no longer there.
The light box was used to remove blockage in both of Garnett's legs. He says the next day he felt fine and was able to walk without pain.
Big relief, because for a minute I thought I was going to lose something down here. You know? So this machine helped a lot to open the veins up so the blood could flow.
St. Peter's is one of 60 hospitals nationwide using the Ocelot system. In New Jersey, Newark Beth Israel Hospital in Newark and St. Joseph's Regional Medical Center in Patterson also use it. Zakir is seeing an increase in patients as the baby boom population ages.
We're having more and more success with this minimally invasive approach as opposed to the bypass surgery. So what we're seeing a shift, a marked increase in the endovascular procedures, and this is actually correlating with a marked reduction in amputations.
Symptoms are often underdiagnosed, but the American Heart Association says the most common sign of PAD is a painful muscle cramp in the hips, thighs, or calves when walking, climbing stairs, or exercising.
So as far as what to do to avoid getting peripheral arterial disease, one, the biggest thing is do not smoke. And then it's just, the other thing is just controlling your risk factors, your diet, making sure your cholesterol is good, your blood pressure is good.
For people with few or no symptoms, PAD can be treated with medication.
The classic symptom is what we call claudication, and that's when they walk a certain distance, they get excruciating pain, most commonly in the calves, but it could be in the buttock area, could be in the thighs, depending on the location of the blockage. You realize that, things that you're able to do before you just can't do.
According to the National Lung, Heart, and Blood Institute, people with PAD have a 6 to 7 times greater risk of having a heart attack. If you think you might have PAD, see your primary physician or a specialist like a cardiologist or podiatrist. Reporting at St. Peter's University Hospital in New Brunswick, I'm Lisa Wojtycki for WMBC News.